Hi guys, and welcome back to my channel. My name is Bridget and I had VSG surgery on, I always forget this part, it's January 30th of 2020. So we're gonna start with stats. The beginning of my weight before surgery, before any consultation, just me, started with 248 pounds. Pre-op weight was 234 pounds. My current weight right now is 207 pounds. So my weight pretty much goes up and down a little bit. It goes from 200, it goes from 205 to 207. It goes like that. There was a time, I think the day before yesterday, I was 204, I believe, but then I went up to 207 because that day I had a lot of fluids. I'm trying to keep up with my fluids. So, how I'm feeling after a month of surgery. So you guys know it wasn't easy for me from the beginning to now. It's been really hard for me. So there are good and bad days sometimes. I wouldn't say all my days are bad. I wouldn't say all my days are good. There's days that I wake up and I'm a little tired, more than usual. And there's days that I wake up with so much energy. And I haven't felt that energy in a long time. And I thought that I was going to be able to feel like this sooner. But I'm starting to experience it now and I like it. I'm able to wake up. I'm ready to do things, you know, and that's a good feeling because I'm starting to feel a little bit like my old self. And that's a good thing. Perhaps more energized than I did before. So that's a great thing. As far as pain goes, I have no pains. I don't feel any pain at all. Maybe a little discomfort according to certain foods, like depending what I eat or what I'm trying to eat, because I'm at the stage where I can try certain foods and certain textures. So, you know, depending on that, like I think I tried a chip, and some of them go well, some of them don't. So I don't eat lots of it. I just like try a little bit, you know, see how that goes in my stomach. I noticed that I had a spinach and cheese dip the other day and that hurt my stomach. I don't know why, because I usually have cheese, you know, not every day, but I have tried it and it just went down easy. So no pain. I don't feel any pain at all. Just extremely itchy on the incisions. I know there is the 3 that I have on the side, they don't itch. Just that really bad one where I guess where my stomach came out from, which happens to be right where which happens to be in a really bad spot, which is right where my pants sit. So whenever I wear anything, it just sits there and then it itches the hell out of me. That one is extremely itchy, just that. My doctor wanted to check my heart and to make sure that everything was well, and everything came back great. No heart problems, none, anything like that. So that's a good thing because I was kind of worried about it, but you know, they reassured me that everything was fine, so made me feel a lot better. I don't know if everybody goes through this, but I noticed that my mood changes sometimes, and my mood changes sometimes, and I don't know if that's a normal thing. I don't know if that's something that we go through it or it's just me, but I feel sometimes I get a little bit of anxiety, a little bit of depression sometimes. I wouldn't say depression, but because I don't want to take that word lightly, but I do get a little down. I don't know if that's just a process phase or, you know, I'm not sure. I don't really sit and think about it too much because I really don't. I just want to just, you know, I quickly change my way of being. Like, I don't want to sit and dwell on. So I still find it very difficult to use the bathroom. Yes. I can go a whole 2 weeks without using it. There's things you can take for it. I know you can take Dulcolax, you can take this other thing that the doctor prescribed me. But when I took the this liquid, it's like a syrup. It's very nasty going down. It's very sweet, so it was really hard to just bring it down. So I didn't take that one. I think I took it once and it worked like this, but I didn't feel good because my stomach was hurting after it. So I was gonna go when I go and then that's it. But I'm trying to add flax seeds to my smoothie, so maybe that would help. As far as heart palpitations, I still have them whenever I go up and down my stairs, or sometimes I forget because sometimes I am energized. So I try to do a little extra or move a little extra. You know, I could feel it. I could feel it. Like there's mornings where I wake up really energized and I do a little too much, and then by the afternoon I'm like I'm just like this the whole afternoon, and I want to take a nap and I want to relax. I think that's normal. I asked the doctor the other day if that's okay, you know, just pretty much what I'm feeling, and he said, yeah, that's fine. It's just because your body's getting adjusted to it, and if you feel like you need to rest and relax, just do that, rest and relax. So pretty much I just listen to my body. Like when my body wants to get up and do something, I do it. When my body wants to just lay in bed and do nothing, then that's exactly what I'm doing, nothing. As far as food goes and what I can eat, it's pretty limited. I still can't bring down a lot of things. Don't know why. I know a lot of people, some of you guys said it's because when I went to surgery, the anesthesiologist had to kind of force the tube down my throat. It could be that. It could be that it's just healing and it's taking a little longer. And I'm fine with that. So I'm not sure. The doctor is really not sure either, because you know, he could just tell me a patient he did 2 months ago is doing great, or a month ago, and it's just not it's not what I'm feeling. So he tells me pretty much just listen to your body. Your body's gonna tell you what it's ready to eat, and what my body's telling me to have is smoothies and still kinda on the smushy liquid in between, and I'm okay with that. I'm fine. I'm not trying to rush to I want to eat this and I want to eat that. No, that's not what I'm doing. So I'll pretty much have a green smoothie in the morning. I love those. Those are really good. Then I have like a soup. I really don't have a time schedule for my eating. I don't have, oh, by 9 o'clock I gotta have this, by 12 o'clock I gotta have that, and I don't stress myself. That's just me. I don't stress myself for the protein either. I don't stress it. I don't like, oh my God, it's 5 o'clock, I need to get my proteins. That's not me. I'll take a smoothie, which I know my smoothie in the morning contains about, on top of my head, I would say about 18 grams of protein, and that's fine by me. And that's included in my chia seeds and my hemp seeds, you know? And then I can take perhaps another one if my body wants it. I'll take another one around 2. And then by the afternoon, I have like a chicken soup, no pasta, just chicken soup. I add a little bit of veggies, like a little bit, like a half a potato, and I just like smush it and make it like kind of smushy. I have a little piece of meat that I'll, you know, just shred real small so it can go down. Another thing that I tried, because I noticed that chicken breast was just a little too dry. Even when I make it in soup, it was just too dry for my throat. You know the chicken necks? Okay, so I add just one piece of chicken neck into my soup, and I'm able to just with my teeth kind of like take out the little pieces, because there's just very little meat in the chicken. You know, the chicken neck is about this little. So it's very little meat, but I get to have some of the soup, and it just goes down good. So pretty much that's my meals every single day. Tried, and I know it goes down good. I just don't have it every day. It's mashed potatoes. They go down fine. I had it, I think maybe 3 times, and they weren't bad. It's just I feel like I fill up quick with those. I feel like 3 little spoons, they fill me up like this, and I don't like the feeling of feeling very full. But I notice about 3 ounces of my broth or my soup, it sits well with me. Like I don't feel like I'm overstuffed the way as if I was to put 3 ounces of mashed potatoes. I mean, like it's just it feels different in my stomach. It might be the same amount, but the potato is just feel heavier on my stomach. Um, as far as fruit goes, I can have a lot of fruits. Most of my fruits, I just add them to my smoothie. Let's go. I just eat it regular, the way you eat a banana. I just make sure I do a lot of bites. And I buy the small bananas, the small red bananas that they sell. Those are favorite because I could finish a whole banana, no problem. Another thing that I had was watermelon. That went down easy. Papayas, I'm loving papayas now. I introduced them this week and I'm loving them. Like I can eat a lot of papaya. It was a whole, I would say maybe this big of a bowl with chunks of papaya. And I was surprised that I was able to eat all of them. No problem. So that was good. It was very refreshing. So I know I'll be having that for the summertime. Pretty much what I have. I don't have any other type of meats. I only tried fish a couple of times, and one day it went down well. The other day it didn't. It just came all out. So I was just like, you know what? Maybe I'm not ready for fish yet. I tried shrimp. It did not sit well. It came right out too. So that's why right now it's just pretty limited. And I'm okay with that. I'm not rushing. My time will come when I can have things without running to the bathroom. Exercise. I don't exercise. I know I'm supposed to be cleared already. I haven't seen my doctor yet because my appointment is coming up, but I don't exercise. I don't think I need to exercise right now because I'm eating pretty limited. So I don't want to do that to my body. I don't want to go jump in the gym and do that to my body because I eat very limited. You know, I probably maybe have like not even 500 calories a day. So why would I even work out? I do things around the house, like I mop, I vacuum, I clean up the house. And my house is a 3-story house, so there's a lot of walking and there is a lot of going up and down the stairs, and I'm constantly always moving. I have 4 dogs, so I'm very active with them. Keeps me very active. I'm starting back on my house activities, which is cleaning, cooking, washing dishes, doing laundry. So that already, I feel like it's an exercise of its own. You know, when I gotta load up the dishwasher, when I gotta load up the washer, you know, bend down, get up. I guess just do stuff like that around the house. Talk about, it might be too TMI. As for some of you guys, maybe not, who are just got surgery, or you know, you're a week or 2 weeks or 3 weeks within surgery and you're asking yourself when it's time for sex. So I waited, Jesus, close to a month, and I felt ready, but my body the next day was like, no, boo, I don't think we're ready. I was feeling very weak, very achy in my body, including my area, including my lower area, like my hips and my legs. They were just hurting. I don't think I was fully ready for that. So that was the first time. I felt really crappy the next day. Then the second time, it was like, yeah, I don't think we're ready again. So I'm pretty much just gonna wait on that. So I mean, I cannot tell you if you're ready or you're not ready. That's up to you. I'm just telling you what I went through as far as that goes. But I'm just gonna leave it there. So as far as vitamins go, I still take the Vitafusion Organic. I still take this every day. And I take B12. And my doctor prescribed this. It's a 500 mcg. And it's Nascobal. I think I'm pronouncing it right. It's Nascobal. And it's pretty much, I'll show you guys. It's pretty much, it looks like a nasal spray, I would say. So you pretty much just breathe it, push it, and you know, that's how I take my B12. That gives me energy. I take it once a week because That's what the doctor told me to take. And I still continue to take my vitamin A's. That's pretty much all I take, nothing else as of right now. I am probably going to introduce, I was looking into prenatal vitamins, but I'm just going to wait to see my doctor the next time I have an appointment and just ask him, can I take that? Just to be sure, you know, you never know. So nothing must have changed but the fact that I feel better. As far as how I'm feeling about my surgery, I still have mixed emotions. Please don't come for me. I've seen a couple of comments. I'm not the one to respond to comment. I'm not the one to kind of respond to rude comments and continue with that, because I don't think people understand there are different journeys. I respect everybody's comments. That's just what their opinion, and that's fine. You're entitled to your opinion. But when you're judging, or when you're telling me that I wasn't prepared for my surgery, or when you're telling me that I'm a complainer, or when you're telling me that I might not be doing right, and you're questioning what I'm doing, is when I have a problem. I don't let it get to me. I just pretty much ignore it, or perhaps don't answer if I don't feel like it. But I don't, and it's funny because I had a couple of comments, and these comments came from people that they didn't even have the surgery yet. So I'm looking at them like, did you even have the surgery? I mean, I can sit and talk to somebody who had the surgery, and she could tell me, or he could tell me his experience, and I could take it and be like, wow, that's great for you. And, you know, I don't feel any type of way towards it. And I know a lot of you guys did that with me. They told me, oh, I had my surgery and it's completely different. And I feel you guys, and I appreciate that so much, because there was a lot of times where I was feeling really, really down, and just having a notification on my phone saying that you guys wish me well, and you guys wish that I recover fast, and you guys are going to pray for me. And that just meant a lot to me, and it really made my day. And it kind of it pushed me to be like, you know what? I don't know, it just made me feel better, and it pushed me to be a little bit more positive. The video that I did a while back, that I think I did show like my body. So I'm going to do that for the next video, because I want to get more into it, and I don't want to make this video super long. So I am going to do that. I am going to show you, girls, guys, there is a lot of loose skin. A lot. I don't know. I feel like it is. Maybe if I see like the video like that, you know, it might help. I don't know. Because another thing that I heard that it happens, but I didn't experience it yet until recently, is my mind is not catching up with where my body is, if that makes any sense. Like when I look at myself in the mirror, I still see myself before, but when I put on my clothes, it's a little loose. It's like loose, and I'm like, I don't feel it. I don't know if that ever happened to anyone else, but it happens to me sometimes. Like when I put on pants, my mind is still looking at the old person. But my body, you know, I wouldn't say it's like changed completely 100%, but it's just different. So my mind is trying to catch up with what my body's doing. I'm happy because of my surgery. I'm happy that I feel a little bit more energized. I think my frustration comes when it comes to eating. Believe it or not, that is my frustration when it comes to food, because there's times, right, where I'm eating, and there's times where I'm eating, and then I'm eating, and then sometimes I forget that I had surgery, and then I go and put a spoon, and then because I'm thirsty or whatever, and then I just go ahead and put another spoon, and then I'm like, oh my God, I'm choking, you know, or it hurts, or my stomach gets to the point where if I do that, then my stomach is like, yeah, we're not gonna eat. You're not gonna eat for the rest of the day. Like, you hurt me. So then my stomach is acting up, and then doesn't want to eat no more. And it starts to feel uncomfortable, and it bothers me. And then I get like the acid, the acid. Then I feel burpy, and then I'm like the whole day I'm burping, and I feel like the acid reflux coming up, and then this just messes me up. I think that's the part that I don't enjoy about the surgery as far as now. The fact that I don't have the control. I don't feel in control when it comes to my eating. You know, before you would eat and you would eat normal, what you consider normal, what I consider normal, right? So now I feel like I have to take these little baby spoons, and sometimes, let's be freaking honest, I don't have 30 to 40 minutes to sit down and eat. I don't. Like, every time I gotta eat, I gotta be like, well, let me just take a break for 30 minutes and just try to eat this. And I know some people are gonna come at me and be like, well, it's better than what you were before. Yes, I'm not gonna say that it's not, but sometimes it be frustrating. I'm sorry, it's just fucking frustrating, because I'm like, can we just get past this pace where, can we just get past the phase where I have to take little baby spoons, and if I take 3 baby spoons, that's a little too much. You know what I mean? And it hurts and it's aggravating. And sometimes I'm like, oh, I don't want to eat anything. I just don't want it, you know, because, and then I get upset because I'm a freaking human. You know what I mean? Like, the part that I hate is just the eating. And sometimes I'm like, yo, it's not even worth eating. Where's my smoothie? Let me just drink my smoothie and I'll be fine. Other than that, that's about the only thing that I would say I don't like about the surgery. Everything else that comes with that, hey, the minute I lay down on that operation room and I said yes and I signed the papers and I did what I had to do and paid and did all that, I kind of knew it wasn't going to be easy. You know what I mean? I think everybody is ready until you're like coming out of that surgery room and you're like, shit, what the fuck did I do? You know what I mean? But I think everybody has its moments and then its clarity moments. But when I tried on a pair of jeans or a shirt that I didn't fit, and I'm like, oh my God, like, I'm so happy, like I could fit in these clothes. And that's a great feeling, don't get me wrong. I tried on these pair of pants the other day. I think they were a size 12 that I haven't fit in since 2014. So for me to try on those pair of size 14 jeans was like, I was super hyped. I'll type in the I'll just add the little clip when I put it. And I was super happy, and that was a great feeling, and I appreciate that. And I was like, I even cried, yo. I didn't put that, but I cried. I was like, oh my God. It was, you know, some people will be like, yo, it's just a pair of jeans. No, it's the shit that I went through to fit in these fucking jeans is what you don't get. So that was a good feeling. Those are good feelings. I think what this is teaching me is not to focus too much in food. Food is food for me now. Like, I look at certain things that I craved before and I'm like, it's just pizza. It's just rice. I love rice. I grew up with rice. So whenever I make rice for my kids, I'm like, oh my God, I just want to eat some rice and some chicken and some pernil and some beans. And I can't have that. And it's frustrating. But then I got to bring myself back like, no, we're trying to be sexy for the summer. No. So it kind of, you know, I got to bring my own motivator and kind of motivate myself and say, it's okay, girl. You don't need that. Let's drink this. We're going to be good for the summer. So I'm learning. I'm learning to go through this. I don't think nobody's prepared fully. I think we all have the tools, but nobody's completely prepared to what comes after surgery. That's all I'm saying. Anyway, I know I talked a lot. I am all over the place as always, even though I try, guys. I really try to be to make a better video for you guys. Shit, I even put a little bit of lipstick and a little bit of something, you know, so I don't look so crazy sometimes. But anyway, thank you for watching. Thank you for watching. And guys, I'm such a mess. Thank you for watching, and I hope you guys have a wonderful day. Please, let's not judge me or anybody else. if you're not happy with whatever you see on my channel and you don't agree with me and you can't get past different opinions, then just don't watch me. Or if you bump into somebody else's channel and you don't like what they giving, you don't like the feedback you're getting, or you just don't like their video, don't be rude and leave bad messages. I feel like everybody at this point is sensitive. You're sensitive over things, especially when you're putting yourself out there and you're just saying what you feel. You know what I mean? It's hard. Just let's try to put ourselves in their position and just take other people's feelings into consideration. Enough of that. Thank you guys for watching, and I'll see you guys next time.